All right, let's get right into it. Today we're talking about something absolutely critical in medicine, the race against time to diagnose invasive fungal infections. And look, these aren't just minor issues. They can be incredibly dangerous, and the single most important factor in fighting them is speed. I mean, think about it for a second. How do you fight an enemy you can't see, one that's already inside the gates, multiplying by the second? Every moment that passes gives it a stronger and stronger foothold. That's the intense reality that doctors are up against. And yeah, that right there is the core of the problem. For patients whose immune systems are already weak, a delay in diagnosis isn't just a small setback. It can literally be a matter of life and death. The clock is always ticking, which is why getting that diagnosis fast isn't just important, it's everything. So what's the plan? How do we actually fight back? Well, today, clinicians have this incredible toolkit, a whole arsenal of cutting-edge tests. Let's open it up and see what's inside. Okay, so this table here is basically our guide for this whole explainer. It shows some of the most advanced tests out there today, and each one has its own special purpose. You'll see things like turnaround time and clinical utility, and those are the exact things that help a doctor decide which test to use and when. To really get a handle on this, let's zoom in on a few of the most important tests. We're going to break down how they actually work and, what situation calls for which tool. First up, we've got the broadest tool in the box, the BDG assay. So imagine a fungus leaves behind a very specific kind of fingerprint. It's this sugar molecule called 1,3-beta-D-glucan, and it's a key part of its cell wall. Well, this test is designed to find that exact fingerprint in a patient's blood. Now, what makes the BDG test so powerful is that it's broad spectrum, because that sugar fingerprint is found on lots of different fungi. We're talking things like Candida and Pneumocystis. The test acts like a huge net. It lets doctors quickly figure out if there's any kind of fungal invader in there at all. And the speed? Well, it's an absolute game changer. You can get results in just a few hours, maybe up to a day. Compared to older methods, that is a massive leap forward. It gives doctors that critical early warning so they can start taking action right away. Okay, now let's talk about something even faster, the lateral flow device, or LFD. If you've ever taken a rapid COVID test at home, you already get the basic idea. It's a simple, portable little strip that gives you a quick and easy yes or no answer. This technology is what we call point of care, and it's a huge deal. The LFD allows doctors to get a fast read on specific infections like Aspergillus and Cryptococcus right there at the patient's bedside. There's no waiting around for a lab. You get immediate, actionable information. It's incredible. And the turnaround time is just wow, 30 minutes to an hour. Seriously, in less time than it takes to drink a cup of coffee, a doctor can get a vital piece of the puzzle that helps guide life-saving treatment. That's not just an improvement. It's a revolution in diagnostics. Now, for when you need the highest level of precision, you bring in the big gun, PCR. The easiest way to think of it is like a superpowered DNA photocopier. It finds the unique genetic code of one specific fungus and then makes millions and millions of copies, so that even the tiniest trace becomes completely unmissable. And because PCR is looking for DNA, it's unbelievably sensitive and specific to one species. So it's not just about finding a fungus, it's about identifying the exact culprit. Is it Aspergillus? Is it Candida? Knowing for sure is what allows doctors to choose the absolute best, most targeted antifungal drug. And with modern real-time PCR, that incredibly specific, super sensitive answer can be in a doctor's hands in just 4 to 6 hours. A definitive ID, all within a single hospital shift. So with all these amazing options on the table, how does a doctor actually choose the right one? Well, it all boils down to a really important trade-off. Do you need speed or do you need specificity? It's kind of like this. On one side, you've got a broad test like the BDG assay. It's perfect for that initial screen, casting a wide net to see if there's any kind of fungal problem to begin with. Then, on the other side, you have a super targeted test like PCR. That's like calling in a detective to identify one specific suspect once you already know a crime has been committed. So here's the bottom line. Each test has its own job. You've got the LFD for those lightning-fast results right at the bedside, the BGG for that big picture screening, and then PCR for the definitive, high-sensitivity confirmation. Doctors use these tools together in combination to build a complete diagnostic picture as fast as they possibly can. And that brings us to what really matters. I mean, this isn't just about cool new gadgets or getting lab results a bit quicker. This is about how these technologies directly impact patient outcomes. It's about saving lives. So, what have we learned? Well, first, speed is everything. A faster diagnosis means you can start the right treatment sooner, and that makes all the difference. Second, there's no single best test. It's all about using the right tool for the job. And finally, it's clear that this technology is completely changing the game in how we fight these dangerous infections. When you really put it all together, the message is just so clear and so powerful. In this high-stakes fight against invasive fungi, every single hour that's saved by one of these rapid tests is a life that is given a much, much better chance to survive. And that just leaves us with one final thing to think about. We've watched these tests go from taking days to hours to now just minutes. So as this technology keeps getting even faster, cheaper, and easier to use, what is that going to mean for the future of medicine? How will it change how we fight disease?